Does a particular scar bother you and you think that your confidence is getting affected because of these scars? Well, CO2 laser is one treatment that can help you. I am Dr. Shilpi Vidani. I'm a plastic and aesthetic surgeon at SB Aesthetics, Gurugram, India. When we talk about scars, broadly we can think of two categories of scars. So one is the non-surgical and the other is a post-surgical scars. Now, when we talk about non-surgical scars, they can be acne scars or they can be a scar from a trauma. So when we talk about, let's say, acne scar or scar from a trauma, basically what a CO2 laser does is that it burns little micro holes during the treatment, and then a new skin will regenerate from within this micro injury that we've done in the laser. So that will cause a resurfacing. So when we talk about, let's say, general scars that bother people, so they are mostly scars from an old trauma. So even old traumatic scars can improve by the CO2 laser. Now, when we talk about scars, they can be different types. So even old trauma scars can be of different types. So there are conditions where sometimes only a CO2 laser may not be the solution, and you will be advised for, let's say, a surgical correction, and after that follow up CO2 laser to get the best results for your scar treatment. Now, when we talk about surgical scars, so the surgical scars can be not only from plastic surgery but also from other surgeries. So let's say a gallbladder surgery or a cesarean section, or let's say a kidney surgery that you've had and you don't like the appearance of that scar. So obviously all these scars can be resurfaced by a CO2 laser. When we talk about plastic surgery per se, the most common post-surgical treatments of scars that we do are for breast surgeries and abdominoplasty surgeries, but also liposuction surgery, facelift surgeries. So we treat our patients with lasers, and resurfacing of the scars is routinely done so that one gets the best results of the scar treatment. Now, when we talk about a particular variety of scar, that is burn scar, and it is again, the presence of a burn scar is not only a cosmetic deformity, but somewhere the patient gets reminded of that trauma that the person has had. And that is why we want to treat those scars in the best possible manner. Sometimes these scars can be elevated, so they are called hypertrophic scars, or it could be keloid also, and combination treatments may be suggested. Also in other kinds of scars, let's say even acne scars, we can do combination treatments like fillers or like PRP. So these treatments can be combined to give you the best results out of your treatment. Now, there is one special category that I would like to talk about here is the stretch mark treatment. So when we talk about stretch marks treatment, we get several queries about stretch marks treatment every time. But I will tell you that not all stretch marks are the same, and not all stretch marks will have the same result from a CO2 laser treatment. So obviously, if your stretch marks are very red and wide and thin, then this is not the very ideal case where we would want to do a CO2 laser. But yes, depending on case-to-case basis, we can tell you how much of improvement you will get from the treatment. Another important aspect of a fractional CO2 laser treatment is that it is not only one session but a series of sessions that you will require, the interval of which can be decided according to your condition or the indication that you're getting treatment for. So this was broadly about scar treatment with CO2 laser. Now when we talk about anti-aging treatment, this is a whole different category of treatment that the CO2 laser addresses beautifully, and we can treat fine lines, we can treat deep lines, depending on how deep or how superficial our laser is, how many sessions we are doing. So when we talk about a deep CO2 laser, you may require about 2 to 3 sessions in a year to get the best results. But with a superficial laser, maybe more sessions are required. We also have done peri-orbital or around the eye rejuvenation with CO2 laser, and we are getting very encouraging results there also. So this was about the scar treatment or the non-invasive or the fractional treatment. Now when we talk about surgical mode of CO2, so here we treat a lot of indications like most commonly moles, skin tags, warts, and these are very very easy and quick treatments, lunchtime procedures. You can just walk in and in a couple of hours you'll be free of most of your skin tags or warts, and the mole may take a couple of sessions. But yes, it is a good treatment to opt for if you're not wanting a surgical treatment for the removal of your mole. The age spots also, which feel like little raised black spots on your skin, they can also be very effectively targeted with the CO2 laser. Now, there are certain purely surgical indications. So, for example, we use CO2 laser in our lip reduction procedures. We can also use it for blepharoplasty. And very interestingly, actually, this is such a versatile device that not only plastic surgeons, but also other surgeons like cancer surgeons or oncosurgeons and ENT surgeons also use it very widely in their practice. So I hope with this video, you've got some clarity on what all a CO2 laser can do and how your scars can be very effectively reduced with this treatment. I hope you found this video useful in deciding about your scar reduction therapy with CO2 laser. If you like this video, do like and share, and we keep on posting interesting information about plastic surgery on our channel. Do subscribe to the channel SB Aesthetics. Thanks for watching.